In this video, we will discuss about sickle cell anemia problem and what are the possible uh, pathologies or the cures that are available. Sickle cell anemia. What is sickle cell anemia? We will understand this from the figure that is on the far left side. Far left side. The top figure on the far left side shows the normal cell that are usually present in circle or oval shape, whereas the figure just below that shown the cells that are present in sickle cell anemia patient. So these cells are in the form of sickle, or we can say that they change their shape from the normal cells. And why this is happened? This is happened because of the lack of the oxygen that is available at the to the cells, to the blood cells. And you will understand this why uh, this condition arises. So the protein that is responsible for providing oxygen is the hemoglobin, and there is a change in the, or we can say mutation in the hemoglobin, that results in the change in the shape of hemoglobin, and thereby is not been able to work efficiently as it worked in the case of normal person. So what happens is that in the normal DNA sequence of the hemoglobin, the sequence that is read as GAG has been mutated to GTG in the sickle cell patient. This results in final final change in the corresponding RNA sequence. So the corresponding RNA sequence for the normal patient is GAG, whereas for the sickle cell anemia patient it is GUG, and this results in the change. This results in the change of amino acid that is formed during translation. In the normal case, it is translated as glutamic acid, as GAG code for glutamic acid, whereas GUG code for valine. So in sickle cell patient, the single mutation leads to change in the final amino acid that is uh, formed is valine, and because of this, the sickle cell patient has a hemoglobin protein that is different from the normal protein, and because of this mutation there is slight change in the shape of hemoglobin that results in the clumped hemoglobin, whereas in normal case the hemoglobins are not clumped together. And this clumped hemoglobin will is the attribute, or will not be able to provide enough oxygens that is responsible or that is required for normal functioning of the blood cells. And there has been various studies has been done to overcome this sickle cell anemia, and one of the strategy that is presented here is the nitrogen oxide pathology. So what people have observed, the nitrogen oxide, when the sickle cells are treated with nitrogen oxide, there is there is some improvement that has been observed. So this is the deoxygenated blood, uh, and when the or we can say that these are the bloods, and whenever these are the bloods, and in case of deoxygenated condition they form the sickle cells. However, whenever there is a nitrogen oxide treatment, when the cells are come in contact with nitrogen oxide, uh, then there are some of the changes that people have observed in the sickle cell patient, that is vasodilation increases. It means that there is an increase in the flow of blood. So increase in the flow, with increase in the flow of the blood, more supply of oxygen will be provided, and there is an increase in deformity. So the sickle cells that are usually present in the deformed shape, there is a increase in that shape to again deform towards the normal circle or oval shape that has been seen in the sickle cell patient, and the sickling of the cell decreases during deoxygenated stage. and at the same time the sickle cell anemia has not been able to promote effective immune response, and that has been decreased when the cells are treated with nitrogen pathology, and the platelet activation will also get decreased. As in the sickle cell as in the sickle cell patient, it has been observed that there is a frequent activation of platelet because of the shape of sickle cell. It will bind to the uh, endothelial cell close to the blood blood periphery, and that has also been decreased when the cells there is a change in the shape of cells, as it is shown here. The leukocyte and erythrocyte adhesion will be decreased. This cause the activation of platelet. Since this will decrease when there is a change in the shape of sickle cells to the normal circular oval shape, the platelet activation will also get reduced, and and this endothelial cell activation will also link towards this leukocyte and erythrocyte adhesion. Since this get reduced, the endothelial cell activation will also get reduced, and person will not observe uh, abnormal pain because of sickle cell. So that's all for this video. I hope you like the video. Thank you for your time.